All right, so today we're really diving deep into something I know a lot of you have been curious about, Xanax.
Uh,
And it seems like everyone's heard of it, right? But there's also like this cloud of mystery surrounding this little pill.
yeah, there's a lot of buzz around it, that's for sure. But honestly, there's also a good deal of concern, especially here in the US. We've seen a real surge in problems related to Xanax.
And it's exactly why we wanted to do this deep dive. Get the facts straight. So first off, when we say Xanax, we're not talking about painkillers like opioids, even though people sometimes lump them together.
Huge difference. Xanax is classified as a benzodiazepine. They're kind of like the chill pills of the medication world. Their main job is to put the brakes on anxiety.
Chill pills. I like that. Okay, so how does that actually work? It's not like they just magically erase your worries, right?
Right. It all comes down to brain chemistry. Basically, our brains are swimming in these chemical messengers called neurotransmitters, and some of them control how anxious or calm we feel.
Okay, I'm with you so far. But where does Xanax come in?
So Xanax swoops in and boosts the activity of a specific neurotransmitter called GABA. Think of GABA as your brain's natural chill-out signal. When Xanax latches onto those GABA receptors, it's like turning up the volume on that calming message.
So it's like Xanax is giving your brain a big old dose of keep calm and carry on.
Exactly. And it's surprisingly effective. And here's the catch. Xanax is actually classified as a Schedule 4th controlled substance by the DEA.
Wait, hold on. Schedule 4, that's a
Uh,
big deal, right?
Right.
That means the government itself recognizes it has the potential for problems.
Exactly right. Schedule 4th means there are legitimate medical uses for Xanax, absolutely, but it also carries a risk for abuse and dependency, even when it's taken exactly as prescribed.
So there's a real trade-off there,
Hmm.
the benefits versus the risks. Speaking of benefits, what are doctors usually trying to treat when they prescribe Xanax?
Well, imagine that feeling right before you have to speak in public, that anticipatory anxiety. Xanax can hit those GABA receptors so effectively that the fear practically vanishes for some people. It's frequently prescribed for anxiety disorders, panic attacks, insomnia, basically anything where that feeling of anxiety is really causing problems in your life.
Makes sense. But even if it's prescribed, we can't just ignore those risks, right? The source material we're digging into really emphasizes how quickly someone can become addicted to Xanax.
It's true, and ironically, it's that same mechanism that makes it so effective in the short term, that quick calming. But it also makes it really easy to become dependent on it. Like, your brain gets used to having that extra GABA boost from Xanax, and then its own internal chill-out system forgets how to work properly on its own.
Yikes, that's a scary thought. It's like relying on a crutch for so long that it becomes a trap.
That's a great way to put it. And it's a really important point because this is where people start comparing Xanax to opioids.
Right, because even though they work so differently in the body, they both have that very real risk of addiction and even overdoses, especially if they're mixed.
Exactly. And sadly, that's a dangerous combination we see far too often. The research actually highlights a pretty terrifying statistic. Mixing Xanax with opioids increases the risk of overdose by tenfold. That's not just a little bit riskier, it's playing with fire.
Tenfold. That's terrifying. But let's switch gears a bit here. Obviously, knowing the risks is important, but it leads to a big question. What are the alternatives if you're struggling with anxiety?
Thankfully, there are a lot of other avenues to explore, and some of them are surprisingly simple, like lifestyle changes. Getting enough sleep, for example, can do wonders.
Oh, tell me about it.
Yeah.
I know when I'm sleep deprived, even little things can make me feel anxious. But sometimes those lifestyle changes just aren't enough. What then?
That's where things like therapy come in, specifically cognitive behavioral therapy, or CBT. It's not just about feeling better in the moment, it's about rewiring your brain to deal with anxiety better in the long run.
CBT. Sounds intense. What's the basic idea?
Imagine learning to just observe your anxious thoughts as they come up, like they're clouds passing by, without letting them control you. That's the core of mindfulness, which is often a big part of CBT. Recognize those thoughts. Oh, there's anxiety again, but don't let them take over.
Okay, I think I get it. But what if someone is listening to this right now thinking, my anxiety is way too much to handle on my own. I need help now.
And that's exactly why it's so important to remember you're not alone. Besides therapy and lifestyle changes, there are medications out there for anxiety that are not addictive and can be really effective without the same risks as Xanax.
So it's not an either situation. There's a whole spectrum of options.
Exactly. And figuring out the right path often starts by talking to a healthcare professional.
They can help you navigate all those options and find the best fit for you. But before we get too deep into the alternatives, I want to go back to something you mentioned earlier about the way Xanax affects the brain.
Sure. What specifically stood out to you?
Well, you said it's all about brain chemistry. But how can a little pill like Xanax actually have such a powerful effect on something as complex as the human brain?
Ah, well, now we're getting to the really fascinating part. To understand that, we need to zoom in to the molecular level.
So we're talking about, like, the nitty-gritty details of how Xanax actually works on a molecular level. I'm a bit of a science nerd, so this is fascinating to me.
We'll get ready to geek out because Xanax's structure is like, imagine a key and it fits perfectly into a lock. And that lock is your brain's GABA receptors. And that perfect fit, that's what makes it so effective so fast. But it's also why people can become dependent on it so quickly.
Okay, that analogy makes sense. But let's back up a second. We keep talking about GABA receptors. What exactly are they?
Okay, so picture your brain cells like this massive network, right? Constantly sending messages back and forth. And those messages, they come in the form of neurotransmitters. And those control everything, our mood, how we move, you name it.
So like a super complex communication highway.
Exactly. And think of the GABA receptors, like the traffic lights on that highway. So when GABA, that's our chill out neurotransmitter, when GABA binds to those receptors, it tells the brain cells to slow down, ease up on the gas, and that creates that feeling of calm and relaxation.
Got it. So GABA is like the signal, and the GABA receptors are the receivers, like antennas picking up a radio wave.
Perfect analogy. Now, picture Xanax like a little booster rocket, making that signal GABA is sending even stronger. It makes the chill out message louder, clearer, basically turning down the volume on anxiety.
Okay, so that explains why it kicks in so quickly.
Exactly. It's like hitting fast forward on relaxation. But, and this is important, what goes up must come down, right? So when Xanax wears off, the brain's like, wait, where'd my chill go? And that can cause those rebound anxiety symptoms and potentially dependency, like we talked about earlier.
Like your brain gets used to having Xanax as its own personal relaxation guru and forgets how to relax on its own.
Precisely. And that, again, is why it's so important to think about those alternative ways of dealing with anxiety, ways that empower the brain to find that natural balance again instead of relying on a chemical crutch.
Makes sense. So we've talked about Xanax effects, the potential for dependency. But the source material also mentions this term, black box warnings. And that sounds kind of ominous.
Yeah, it's definitely serious stuff. A black box warning is basically the FDA's way of saying, hey, everyone, pay close attention because this medication comes with some really serious risks.
And in 2020, both benzodiazepines like Xanax and opioids got hit with these warnings. What was going on?
Well, the FDA took that step because, frankly, they were seeing some alarming trends. A sharp increase in overdoses and deaths linked to people mixing those two types of drugs. They wanted to make sure both doctors and patients were crystal clear on the dangers.
Like a giant flashing neon sign, proceed with extreme caution.
Exactly. And that just highlights how crucial it is to be completely open with your doctor about all the medications you're taking, even over-the-counter stuff. They need the full picture to make sure there aren't going to be any dangerous interactions.
It's like honesty is the best policy, but with medications, it takes on a whole new level of importance.
100%. Now, knowing those risks is obviously huge, but it's equally important to remember that there are lots of other ways to manage anxiety, effective ways that don't involve potentially addictive medications.
So let's talk about those alternatives. You mentioned earlier that even simple lifestyle changes can make a big difference. Can you elaborate on that a bit?
Absolutely. One of the most effective and honestly often overlooked tools for managing anxiety is exercise. And I'm not talking about becoming a gym rat. Just adding more movement into your day can make a world of difference.
I can definitely vouch for that. I know when I'm feeling stressed, getting a good workout in really helps clear my head. What's the science behind that?
Well, when we exercise, our bodies release these amazing chemicals called endorphins. Think of them like your brain's natural mood boosters, stress relievers. It's like a little reward for breaking a sweat.
So it's like chemically your body is rewarding you for exercising.
Exactly. And the benefits go beyond just that instant mood boost. Regular exercise can actually change your brain over time. It makes you more resilient to stress and anxiety in the long run.
Wow. So it's not just a temporary fix. It's like building long-term resilience.
Exactly. And the best part is you don't need a fancy gym membership or a personal trainer. Find something you enjoy. Walking, dancing, swimming, whatever. Just get moving.
Movement as medicine. I like that. But let's be real. Sometimes anxiety is about more than just needing to blow off some steam. What about those times when it's our thoughts that are the problem? You know, those worries that keep us up at night.
You're absolutely right. Sometimes we need more than just a physical outlet for our anxiety. Sometimes we need to tackle those thought patterns head on. And that's where therapy, especially cognitive behavioral therapy or CBT, comes in.
We touched on CBT a bit earlier, but I'd love to dig a little deeper. How does CBT actually help you change those thought patterns that aren't helpful?
It's like becoming a detective, but for your own mind. CBT helps you identify, challenge, and ultimately change those negative thought patterns, those behaviors that can fuel anxiety.
Okay, so it's about becoming aware of those thoughts, those what-if spirals, and then learning how to challenge them.
Exactly. Asking yourself, is this thought even true? What's the evidence? Is there another way to look at this situation?
So instead of letting those anxious thoughts run wild, you're putting them on trial.
Exactly. And the more you practice challenging those thoughts, the less power they have over you. But CBT isn't just about changing your thoughts, it's about changing your behaviors too.
Okay, I can see how those two things go hand in hand. What kind of behavioral changes are we talking about?
Well, a lot of times, anxiety leads us to avoid situations that trigger those uncomfortable feelings, right? CBT helps you confront those fears gradually and safely, step by step.
So it's like facing your fears, but in a controlled and supportive environment.
Exactly. And as you gradually expose yourself to those triggers, you realize they're not as terrifying as your anxiety made them seem.
It's like you're desensitizing yourself to those triggers so they lose their power.
Yes. And the great thing about CBT is that it gives you practical coping mechanisms that you can use long after therapy ends. It's like a toolkit for managing anxiety in everyday life.
A toolkit for the mind. Love it. But CBT isn't the only therapy out there. You mentioned mindfulness earlier. How does that fit in?
Mindfulness is a really powerful practice, and it can actually be integrated into lots of different types of therapy, including CBT. It's all about learning to be present in the moment without judgment.
Okay, mindfulness. It's a bit of a buzzword these days. What does it actually mean?
At its core, mindfulness is about learning to just observe your thoughts and feelings without getting swept away by them, developing a sense of acceptance. Recognizing those thoughts don't define you.
So instead of trying to fight off those anxious thoughts, you're learning to just observe them.
Exactly. It's about cultivating awareness, that ability to tune into your body, your mind, without judgment.
That sounds incredibly challenging, especially when you're feeling anxious in the moment.
It can be, definitely. But with practice, mindfulness can become a really powerful tool for managing anxiety and just for overall well-being.
Okay, so how does mindfulness actually work in a therapy setting?
Well, mindfulness-based therapy often includes practices like meditation, deep breathing exercises, and even gentle stretching. These help you develop that awareness muscle we were talking about.
So it's like hitting the pause button on those racing thoughts, those anxious feelings.
Yes. And by creating that space between you and your anxiety, you gain a sense of perspective, a sense of control.
It's about reclaiming your power.
Exactly.
Yeah.
And the beautiful thing about mindfulness is that it's not confined to a therapist's office. It's a way of life, something you can integrate into your everyday experience.
So you might practice mindfulness through meditation, but you can also bring that same awareness to everyday activities like eating or walking, even just washing the dishes.
Absolutely. It's about finding those little pockets of mindfulness throughout your day, those moments where you can just be present without judgment.
Sounds very empowering.
It is, and it's a good reminder that healing and growth aren't always about making big, sweeping changes. Sometimes it's about those subtle shifts in how we see things, in our awareness.
Small steps, big impact.
Exactly. But while therapy can be incredibly transformative, it's not the only alternative to consider. Remember we talked about medications for anxiety that aren't addictive? Let's dive into those a bit more.
Yes, let's, because I know for a lot of people, medication is a really important part of their treatment plan.
Absolutely. And the good news is there are several non-addictive medications available that can be really effective at managing anxiety without the risks that come with benzodiazepines like Xanax.
Okay, so tell me more about these non-addictive options. What are we looking at?
One common type is called selective serotonin reuptake inhibitors, or SSRIs for short. These meds basically work by increasing the levels of serotonin in the brain.
Serotonin, that's the feel-good chemical, right?
Yeah, you got it. Serotonin plays a huge role in regulating our mood, sleep, and anxiety. SSRIs help make sure there's more serotonin available in the brain, which can make a real difference in easing anxiety symptoms.
So it's not that SSRIs are like creating happiness out of thin air. It's more that they're helping your brain access those natural mood-boosting capabilities it already has.
Precisely. It's about restoring balance, not masking symptoms with a temporary fix.
I like that. What are some examples of SSRIs that are typically used for anxiety?
Two of the most well-known are sertraline, which you might know as Zoloft, and acetalopram, or Lexapro. Both of these have a really good track record for effectively managing a whole range of anxiety disorders.
Got it, SSRIs. What other non-addictive options are out there?
Another class of medications that doctors use for anxiety are called serotonin norepinephrine reuptake inhibitors, or SNRIs. And as the name suggests, SNRIs work on both serotonin and norepinephrine in the brain.
Norepinephrine. Remind me what that one does again.
Sure, norepinephrine is another neurotransmitter, and it plays a key role in the body's stress response. It's involved in regulating things like alertness, focus, and energy.
So by targeting both serotonin and norepinephrine, SNRIs are basically tackling anxiety from multiple angles.
Exactly. And that can be especially helpful for people who have anxiety along with other things like depression or chronic pain.
It's like a two-for-one deal for neurotransmitter support.
I like that. And like with SSRIs, there are a few SNRIs that are commonly prescribed for anxiety. One example is venlafaxine, which you might know as Effexor.
Okay, so we've got SSRIs, SNRIs.
Mhm.
Any other non-addictive contenders?
Absolutely. There's a medication called buspirone that's worth mentioning, especially for folks dealing with generalized anxiety disorder, or GAD.
GAD, that's the one with constant and excessive worry, right?
That's the one. And what's great about buspirone is that it specifically targets those worry circuits in the brain without causing drowsiness or having that addictive potential we see with benzodiazepines.
So it's a more targeted approach to anxiety relief without those unwanted side effects.
Exactly. And because it's not habit-forming, buspirone can be a good option for managing GAD long-term.
Long-term solutions, that's what we want. Finding what works for you and supports your well-being over time.
Couldn't have said it better myself. But before we move on from medications completely, there's one more category I want to mention. Beta blockers.
Beta blockers. Those aren't typically thought of as anxiety medications, are they?
That's right. They're mainly used to manage heart conditions like high blood pressure, but, and this is interesting, they can also be really effective at easing some of the physical symptoms of anxiety.
Okay, now I'm really intrigued. So we're talking about things like, what, a racing heart, shaky hands, that kind of thing.
Exactly. See, beta blockers work by blocking the effects of adrenaline, which is the hormone behind those fight-or-flight responses.
So it's not that they're addressing the root cause of the anxiety. It's more like they're a support system for those moments when it manifests physically.
That's a great way to put it. Think of them as a way to manage those really intense, acute symptoms, especially in situations where anxiety might be heightened, like public speaking or a job interview.
Interesting. So it's like having a secret weapon against stage fright.
Exactly. Now, it's really important to remember that beta blockers aren't a magic bullet. They don't address the underlying psychological aspects of anxiety, but for those times when you need to dial down the physical symptoms, they can be a really helpful tool.
A valuable tool for sure. And it just goes to show that when it comes to anxiety treatment, one size definitely does not fit all.
You got it. It's all about finding what works best for you, and that often means working with a healthcare professional.
Right, because ultimately it's about taking control of your own mental health journey, finding those paths that lead to lasting well-being.
I couldn't agree more. But, as we've been talking about all these different approaches, it occurs to me that we haven't even touched on some of the most accessible and empowering tools we have, lifestyle modifications.
Oh, and what would those be?
Well, sometimes the simplest changes can make a huge impact on our mental well-being. And the best part is they're often completely within our control.
Okay, I'm all ears. Tell me about these lifestyle tweaks.
All right, let's start with the cornerstone of good health: sleep. You would be amazed at how much of a difference a good night's sleep can make when it comes to managing anxiety.
Oh, tell me about it. When I'm sleep deprived, my anxiety goes through the roof.
It happens to the best of us. And it makes sense. When we don't get enough sleep, our hormones get all out of whack, and that makes us more vulnerable to stress, irritability, all those racing thoughts that come with anxiety.
So what's the magic number for sleep? How much shut-eye should we be aiming for?
It does vary a bit from person to person, but for most adults, 7 to 9 hours of quality sleep per night is ideal.
And you emphasize quality sleep. It's not just about the quantity. It's about making sure those hours are actually restful.
You got it.
Yeah.
And that means establishing a regular sleep schedule, creating a relaxing bedtime routine, making sure your bedroom is dark and cool and comfortable.
It's about making sleep a priority, not just squeezing it in when you can.
Exactly. Because when you prioritize sleep, you're prioritizing your mental well-being.
It's like investing in your peace of mind.
I love that. But sleep is just one piece of the puzzle. Another crucial element is physical activity.
Right. Like we were saying, sometimes you just need to move your body. I know when I'm feeling stressed or anxious, exercise is like a magic cure.
It's not magic, although it can feel like it. There's actually science behind it. Exercise releases endorphins, those mood-boosting, pain-relieving chemicals we talked about earlier. It's like your body's natural stress reliever.
Endorphins, making exercise the ultimate mood makeover.
Right. And again, it's not just about the immediate effects. Regular physical activity can change your brain over time, making you more resilient to stress and anxiety long term.
So we're not talking about becoming marathon runners overnight. It's about finding ways to move your body that you actually enjoy, right?
Exactly. Whether it's dancing, swimming, going for a hike, or just taking a brisk walk out in nature, find something you love and make it a regular part of your routine.
Movement as medicine. I like it. But let's talk about another form of nourishment, food. I've always been fascinated by the connection between what we eat and how we feel, both physically and mentally.
It's a fascinating link. And while there's no magic diet to instantly eliminate anxiety, there's no denying that some foods can either help or hurt our mental well-being.
So what should we be loading up on to give our brains an anxiety-fighting boost?
Well, foods rich in omega-3 fatty acids are a great place to start. Things like fatty fish salmon, mackerel, sardines, as well as walnuts, flax seeds, chia seeds. Omega-3s are like brain food, essential for good cognitive function and mood regulation.
Brain-boosting power, all wrapped up in a delicious package. I'm in.
Right. And don't underestimate the power of antioxidants. They help protect our cells from damage caused by stress and inflammation, both of which can play a role in anxiety.
Okay, so where do we find these antioxidant superheroes?
They're hiding out in those vibrantly colored fruits and vegetables like berries, leafy greens, bell peppers.
Eating the rainbow for better mental health. I can get behind that. What about foods we should be limiting if we're trying to keep our anxiety in check?
Good question. Processed foods, sugary drinks, too much caffeine, those are all known culprits when it comes to making anxiety worse.
They're like the anxiety antagonists.
Well said. Those foods can really mess with your blood sugar, which can lead to energy crashes, irritability, and those dreaded anxiety spikes.
So it's all about finding a balance, right? Nourishing our bodies with whole, nutrient-dense foods that support both our physical and mental health.
Exactly. It's about making conscious choices to fuel our bodies and minds for optimal performance.
Conscious choices. That seems to be a bit of a recurring theme in our conversation today.
And for good reason. Mindfulness isn't just some trendy buzzword. It's a really powerful tool for navigating life's challenges, anxiety included.
So how can we bring more mindfulness into our daily lives? Beyond formal practices like meditation, I mean.
Well, one simple but profound way is to cultivate gratitude.
Gratitude, that warm, fuzzy feeling of appreciating the good things in our lives.
Yes, and research actually shows that practicing gratitude can have a big impact on our mental health. It helps shift our focus from what we're lacking to what's going well, which helps foster a sense of contentment and reduces those negative, anxiety-driven thoughts.
So how do we actually get more gratitude in our daily lives?
It can be as simple as taking a few minutes each day to reflect on the things you're grateful for. You could write them down in a journal, share them with someone you love, or even just think about them quietly to yourself.
It's like training our brains to notice and appreciate the good, even when things are tough.
Exactly. And the more we practice gratitude, the more it becomes a natural part of our lives.
It's like rewiring those brains for positivity and resilience.
Precisely. And that can make a world of difference when it comes to dealing with anxiety.
So we've covered sleep, exercise, nutrition, mindfulness. Are there any other lifestyle changes we should have on our radar?
You know, we've covered a lot of ground, but there's one more area I'd love to touch on, and that's the power of connection.
Connection. That feeling of belonging, the support we get from our relationship.
Exactly. Humans are social creatures at our core. We need connection to thrive. And research shows that strong social connections can actually act as a buffer against stress and anxiety.
So when we feel supported, loved, we're better equipped to handle whatever life throws at us.
Absolutely. And on the flip side, social isolation and loneliness can make anxiety and other mental health challenges even worse.
It's like that saying, a burden shared is a burden halved.
I love that. So if you're struggling, don't underestimate the power of reaching out. Talk to your loved ones, join a support group, even just engaging in activities that get you out and interacting with others.
It's about nurturing those connections that nourish us.
Beautifully said. Because at the end of the day, Our mental well-being isn't just about what's happening inside our own heads. It's also about the quality of our connections with other people.
We're not meant to go through life's challenges alone.
You got it. And those connections, those bonds of love and support, they can be incredibly healing.
Speaking of healing, the source material mentions a specific resource, the Rolling Hills Recovery Center. We mentioned it earlier.
Yes. And this is a place where people who are struggling with Xanax addiction or any substance use disorder can find really compassionate and comprehensive treatment.
What is it about Rolling Hills that makes them stand out?
Well, for one thing, they take a holistic approach to addiction treatment. So they're not just focused on the physical dependency, but also the underlying emotional, psychological, and social factors that contribute to substance abuse.
It's about treating the whole person, not just the addiction.
Exactly. And they offer this wide range of evidence-based therapies, including individual therapy, group therapy, family therapy, and those alternative modalities we were talking about earlier, like mindfulness and yoga.
It's like they're providing a whole toolbox of resources to empower people in recovery.
Yes. And they understand that addiction recovery isn't a one-size-fits-all thing. They personalize treatment plans to meet each person's unique needs.
That kind of personalized approach can make all the difference.
Absolutely. And it's not just about the clinical side of things either. At Rolling Hills, they really emphasize community. They create this incredibly supportive and nurturing environment where people can heal and grow.
Because recovery is about so much more than just abstaining from substances, right? It's about rebuilding your life.
He hit the nail on the head. And that's where that sense of community, that feeling of belonging and support can be so essential.
Knowing you're not alone on the journey.
Exactly. And Rolling Hills provides that safe, encouraging environment for people to heal, grow, and reclaim their lives from addiction.
It's truly inspiring to know that there are places like that out there. Places offering hope and healing.
It really is. And it's a reminder that no matter how challenging the road to recovery might seem, there's always support available.
Always support available. Those are reassuring words for anyone out there who's struggling with addiction or for their loved ones.
You got it. Because the bottom line is recovery is possible.
And hope is a powerful antidote to despair.
Couldn't agree more. You know, as we've been discussing Xanax, addiction, and recovery, I realize we haven't really touched on one really crucial point.
Ooh, and what's that?
That statistic about how many people personally know someone who has died from a drug overdose, it's a really sobering thought. It reminds us that this is about more than just medications. We're talking about real lives.
It really drives home the point that we need to be having more open and honest conversations about addiction.
Yes, we have to break down that stigma, encourage people to get help without shame, and make sure a compassionate, evidence-based treatment is available for everyone who needs it.
Because addiction can affect anyone.
Absolutely. It
Right.
doesn't discriminate. And the more we understand about addiction, the better we can support those who are struggling and create a society that chooses compassion over judgment.
Well said. Now, throughout this deep dive, we've been talking a lot about the potential risks of Xanax, the things it's so important to be aware of.
And rightfully so. But it's also important to acknowledge that for some people, under the guidance of a medical professional, Xanax can offer relief from truly debilitating anxiety.
That's an important point. It's not about demonizing the medication. It's about making sure it's used responsibly and appropriately.
Exactly. And it's about recognizing that there are many paths to healing and well-being. What works for one person might not work for another, and that's okay.
It's about finding your own path with the support of qualified professionals.
Precisely. And remember, you don't have to go it alone. There are resources available, people who get it and genuinely want to help.
Speaking of resources, we've mentioned the Rolling Hills Recovery Center throughout this conversation. For our listeners out there who are hearing this and thinking, I need that support, what is it that makes Rolling Hills so unique?
Rolling Hills is special because they offer that holistic approach to addiction treatment that we talked about. They get that addiction is complex, it affects every part of a person's life.
So it's not just about addressing the physical aspect of addiction, but also the emotional, psychological, and social factors at play.
Yes, absolutely. They offer a wide range of therapies, everything from individual counseling to group therapy, even mindfulness practices, and those are tailored to each person's needs.
It's like giving someone a toolbox full of resources so they can really take ownership of their recovery journey.
Exactly, and they really emphasize the importance of community there. They've created this really supportive, understanding environment where people can focus on healing and growth.
Because recovery isn't a solo mission.
Right.
It's about connecting with others who understand what you're going through.
Yes. And Rolling Hills really fosters that sense of connection, that feeling of belonging, which can be so, so important for lasting recovery.
It's inspiring to know that there are places like Rolling Hills out there offering hope and healing to those who need it most.
It truly is. It's a reminder that no matter how tough things might seem, recovery is always possible.
Well said. And on that note of hope and possibility, I think we'll wrap up this deep dive into the world of Xanax.
It's been wonderful exploring this important topic with you.
Likewise. And to our listeners, thank you so much for joining us on this journey of discovery. We hope you found it insightful and empowering.
Until next time, take care of yourselves and each other.
And remember, there's always hope, even when things feel difficult. Take care. It's like you were saying earlier, knowledge really is power. The more we understand about these meds, the better decisions we can make.
Absolutely. And sometimes those decisions mean having those sometimes difficult conversations with our doctors, advocating for ourselves, really understanding what our options are.
Yeah. And there's no shame at all in asking for help, whether it's therapy, medication, changing some lifestyle stuff, or some combination of all of that. It's about finding what works for you so you can live your best life.
Couldn't agree more. You deserve a life that's not ruled by anxiety, and there are people out there who can help you get there.
Absolutely. Now, before we wrap up this deep dive into all things Xanax, I did want to circle back to something you mentioned before, that really kind of alarming statistic about how many of us know someone who's died from an overdose.
It's a pretty stark reminder, isn't it, that we're not just talking about pills and prescriptions here. We're talking about real people's lives.
It really underscores the importance of having open, honest conversations about addiction.
Yes, exactly. We've got to break down the stigma. We have to encourage people to ask for help if they need it without feeling ashamed, and make sure that anyone who needs it can get compassionate, evidence-based treatment.
Because the truth is, addiction doesn't care who you are. It can affect anyone.
Exactly. It doesn't discriminate. And the more we understand about addiction, the better equipped we are to support those who are struggling. We can create a society that leads with compassion instead of judgment.
Beautifully said. Now, throughout this deep dive, we spent a lot of time talking about the risks associated with Xanax, the things to watch out for, which is so important.
Rightfully so. But it is also worth remembering that for some people, when it's carefully managed by a doctor, Xanax can provide really important relief from anxiety, especially when it's really debilitating.
That's a really important point. It's not about saying the medication is inherently